Okay, so here we are. We're going to give you a little follow-up. Our patient is doing so well. She has lost about 2/3 of the volume from each leg. So we're going to show you her before and afters here in just a minute, but exceptional work. Took some doing. You know, John had to really work with her in the beginning as far as the education part. A lot of what we do is teaching, right? We want to educate you about the problem that you have and what you can do to fix it. And so that's the hardest part, at least from my perspective, is kind of getting the patient to say, okay, I can do this, and have them be able to take care of their legs themselves, because that's our ultimate goal. So anyway, how are you doing as far as your legs go?
I'm doing great. I'm just overwhelmed and amazed.
Good, good. What do you think as far as your mobility? Do you notice, what do you notice that's different about your mobility?
My mobility, well, I can get around a whole lot better than what I did when my legs were so swelled.
Good.
And I'm walking better.
Good.
And I can get around just real well.
Okay, perfect. And that's what we would expect. You want to pan down and just kind of show her garments? So these are the garments that she is in now. These are an elastic garment. Sometimes we use a Velcro, sometimes we use elastic. Honestly, it really depends on the situation and the person and what they can do. But she's doing great, and we'll show you the pictures, but her legs were, again, about 3 times the size that they are now. And so this has been a great transformation. Super excited for her. If you have swelling, it's a problem. Now, what I haven't talked about is we're now going to fix the underlying vein problem, because a lot of people don't realize that they have a vein problem first. It goes untreated for years and years and years, and they end up with a secondary, what we call lymphedema. And that's probably what has happened in your case. But anyway, there's no way to know that for sure, but we're going to take care of the vein part now. And you say, well, why would we do that? The legs are small. Why do we want to take care of the vein problem? Well, because this is an ongoing problem. Now we're going to take care of the veins, because that downward flow in these incompetent veins is putting a lot of pressure on the already faltering lymphatics. And so we've got the swelling under control. So now we're going to decrease the pressure on those legs by fixing or getting rid of the veins that are not working correctly. So anyway, she's doing great. Wanted to give you a quick update. If you have questions, if this is you, if these are your legs, if you're having problems and you kind of have that feeling of despair and don't know what to do, don't know where to turn, and you feel like you're essentially become a prisoner to these swollen legs, give us a call, because a lot of times there's something we can do to help. Because I guarantee you, did you think when you started this process a couple months ago that you would be where you are now?
No.
Yeah. All right. Anything else you think is important? What about John? What do you think about John?
John's wonderful.
John is wonderful. John did a great job. I mean, again, kudos. This is all John. This is not me. This is me overseeing the process, but John did all the work. John does all the teaching, and now I'm going to come in and I'm going to take care of the vein part of the problem. So thanks. Yeah, last thing. We try to educate people, so please hit the like button, please subscribe. All that does is tries to send the message out there that, hey, we want these legs that nobody else wants to see, because we think we can help them. Not every situation we're going to be able to, but in a lot of them we will. So again, super excited for you.